I went to Ghana for the first time back in 2010. And after spending time in the capital city at the National Teaching Hospital, I then went up to the most northern region of Ghana. They have regions as we have provinces. And I went to a very typical village, which had a very typical rural district hospital called the Sanama District Hospital. And this hospital had one doctor for almost 90,000 people. And you walked in and they had 2 thermometers to serve that population. 6 were there, but 4 were broken from extreme overuse. And it was peak malaria season, which affects children the hardest. So there was 3 kids per bed and beds all over the floors. And yet in the history of this hospital, they've never had a single piece of pediatric medical equipment. So they were using adult blood pressure cuffs on a malnourished 8-year-old trying to detect a reading, which would not work. And they were using an adult stethoscope on a newborn trying to detect a congenital heart defect. They had absolutely no capacity to monitor or provide then any level of real medical care for pediatric patients. And then in the adult wards, anything that was fortunate enough to have been present had been overused for such a period of time that it no longer retained its accuracy. So they had maybe a few old mercury style blood pressure apparatuses, which the readings can be inaccurate and the mercury can block. The only patient monitoring device was reserved strictly for theater, and even it had been there for over 10 years. Without having basic diagnostic equipment present in the hospital, the staff had no way to effectively or efficiently provide medical care for their patients and respond to changes in their condition. And when a patient turned into a critical condition, they would almost always die just because the staff had no idea even that it was in those critical moments when they would have to react fast. So one day there was this 12-year-old boy named Moses that I'd made friends with. He was admitted to the male ward, and he was one of these cases that on the 3rd day after the staff had actually reported that he was getting better and his condition was stabilizing, he died 3 hours later after I left the hospital. And there was some internal bleeding the staff wasn't aware of, and they had no idea that his heart rate was rapidly increasing, his blood pressure was rapidly decreasing, and he ended up dying. And I went back in the next day and I found out, and I was pissed because in my mind I knew without a doubt that he never would have died in the most basic facility in Canada. And so it became a human rights issue to me. It became a social justice issue to me. Because by virtue of being born in that facility, in this community, does that justify and make it okay that he can die there when he never would have to die here? And the answer was no, of course not. So I saw basic diagnostic medical equipment as a way to address this issue and empower the staff to be able to provide care for their patients and save somebody like Moses.